All right, great. Well, we are a minute or two past, so I will get started here. Looks like folks jumping in has slowed down. So, welcome and thank you everyone for joining us this afternoon. My name is Kory Mertz with the Audacious Inquiry team. We are very glad to share this overview of a new data sharing agreement, the IZ Gateway Multi-Jurisdictional Provider Jurisdiction Exchange Agreement, or PJA. This is an exciting document as it's going to help facilitate federal agencies, including the VHA, and other multi-jurisdictional providers sharing immunization data through the IZ Gateway to IIS. VHA has been a great partner in this work, and we're really excited that they will be sharing data with IIS through the IZ Gateway. The PJA is an essential component for any IIS looking to exchange data with VHA. And VHA in 6 states have already signed the PJA, which we're really excited to mention. And we're certainly, I know a lot of other states are kind of in process of looking at it. And again, we're excited today to kind of talk through the details. Before we do keep going, I did want to just kick it over to our colleague from VHA, Julie, who will just kind of give a few quick remarks about VHA's interest, and then we'll run through the details. Go ahead, Julie.
Yeah, thank you, Kory. Good afternoon, everyone. My name is Julie Patel. I work alongside Dr. Pam Belperio and Tim Wong as a part of PA business team in this project. On behalf of the VA, we would like to thank you everyone for the time, efforts, and opportunity to work with you. And we are looking forward to the next steps. To date, VA has signed the agreement and the VA development team has already started working, which is currently underway. And I just want to add that this project is a very high priority for VA Secretary. So we are really excited about it. And again, thank you, everyone.
Great, thank you so much. Again, we really appreciate your guys' partnership. So at this point, I'm going to keep moving. I do just want to mention, if you have questions as we're going, please put them in the chat. Or the Q&A feature. We'll try to stop at various points if there are questions that have come in, or if we don't get to it, we will kind of have time at the end for Q&A and make sure we kind of run through all your questions. So again, what are we doing here today? We're going to provide a review of information needed by parties to support the execution of an agreement required to exchange data with the Department of Veterans Affairs and other multi-jurisdictional providers, right? And so that is the PJA. That's what we're going to be touching on here today. So to do that, we're going to run through a couple of things, right? So I will talk through kind of a quick overview of the IZ Gateway and the supported use cases. Talk a little bit about some of the security considerations and jurisdictional controls, and then we'll really do kind of a deep dive on the IZ Gateway framework and the PJA, and then again, we will kind of have questions and answers at the end of this. So, these are the kind of speakers today, right? So I'm representing the IZ Gateway team. We'll kind of talk through some of the programmatic pieces, and then Chris from the NPHL is going to provide, well, again, NPHL is a great partner for us. They provide the legal support and guidance to the IZ Gateway team, really important partner for us. Chris will be walking through the kind of specifics of the PJA and again, the kind of broader IZ Gateway legal framework. So the bios are in here. You can get the slides on the NPHL website later, and you can look through the bios in more detail. So let's keep going. For the introduction to the IZ Gateway, I think it's really important to remember the IZ Gateway is a cloud-based message routing service for immunization data exchange. It offers a consolidated integration hub for data exchange with standard onboarding and testing processes. And of note for this group, right, the policy framework for the IZ Gateway is kind of really important and helps organizations like federal agencies and the VA and others exchange data with the immunization registries. And kind of one of the key goals of all this stuff, right, both the kind of technical side and the policy framework, is to make it easier for everyone to kind of get the data where it needs to go and make sure it's kind of following the rules. So like I said before on the last slide, the IZ Gateway is a message router, and it's really focused on enabling more complete patient immunization histories for IIS, for providers, and for consumers. And we'll kind of talk through those use cases in another slide or two here. But really important to remind everybody, right? The IZ Gateway does not store data. It's not a message repository. and it does not send data to CDC repositories either. So again, if there are additional questions about this, we can kind of hit on this in the Q&A for sure, but just a couple important points I wanted to remind everybody about. So we will kind of quickly touch on the use cases, right? And so this first use case that's up here, right, exchange data with vaccine providers, that is really the kind of core one that we're going to focus the discussion on today, and the one that PJA is really most relevant to, right? And this is these kind of multi-jurisdictional provider organizations using the IZ Gateway to submit vaccine information to IIS. The second use case is supports the ability of IIS to exchange data with one another. And then the third use case is the ability for patients to be able to kind of log in through an app or a patient portal and access their immunization data. So again, the second and third use case, we just kind of want to remind you as part of the framework, those are not the focus of today. It's really on the kind of exchange of data with vaccine providers. And as you think about the data flow, right? This diagram depicts how data flows over amongst the parties that are part of the kind of IZ Gateway, right? So as you kind of start on the left-hand side of the screen, you have the multi-jurisdictional vaccine providers, and that data goes to the IZ Gateway in the center, right? And the IZ Gateway is a cloud-hosted infrastructure by the Association of Public Health Laboratories, and they host this infrastructure on behalf of CDC. And so, right, the kind of message will go to the IZ Gateway, and then it'll be routed to the appropriate IIS. And it's important to keep in mind, right, the arrows are double-sided because each VXU or vaccine reporting message comes with an acknowledgement message, right? So this kind of information goes both ways. And similarly with the QBP or query for vaccine history, comes a vaccine history or related response. The other thing that's really important to keep in mind here, right, and it's kind of depicted on the right-hand side of this in the dotted line. The IZ Gateway is, these are kind of the dotted line, right, is the existing relationships and the existing connectivity that IIS already have. It's really important to be clear, the IZ Gateway is not aimed at replacing that kind of existing functionality or connectivity or those kind of relationships, right? So it's not aimed at kind of touching any of the existing data flows and connectivity that IIS have. So let's keep going. On this slide, again, this is kind of focused on the use case we are kind of honing in on here today. I want to highlight the policy requirements for this use case. So first, right, kind of a core element for all this, though, is the APHL DUA. And the vast majority of jurisdictions have already signed this, but that is a key component of this. And next is the multi-jurisdictional provider IIS data exchange agreement, or the PJA, right? Again, this agreement was published on January 14th, and it's the kind of core of what we're going to be focused on today. And we're going to be talking through all the kind of nitty-gritty details of it. And again, this use case is the one that allows for vaccine administration information and vaccine history queries to be sent to IIS from vaccine providers. Not going to really spend time on these other ones, but again, right, this is the kind of IIS to IIS use case, and kind of one of the big differences here, right, as you kind of think about the policy framework, is that in addition to signing the APHL data use agreement, you do have to kind of sign on to the appendix, which is the share task order. And again, we'll touch on this in a little bit. One of the really important things to keep in mind with how the IZ Gateway is set up is that IIS get to choose which use cases they participate in. And these appendices to the data use agreement are kind of where you articulate, hey, I want to participate in use case 1, I don't want to participate in use case 2, or however your IIS kind of sees, however your IIS decides to participate in this framework. And then again, right here are the kind of policy requirements for the consumer access use case. Again, the kind of APHL DUA and the access task orders are the kind of core things that have to happen there. All right, so just to keep humming along here, as we think about security and kind of control under the IZ Gateway framework, and I just touched on a little of this, but again, this is really important, right? One of the key things here is that IIS have control of how they interact with data exchange partners through the IZ Gateway. IIS choose the use cases in which they will participate in and which partners they will exchange with. We've heard this is a really important thing to the community, and we've tried to do our best to make sure the IZ Gateway is aligned with that. So again, you have to kind of set up or enroll data exchange partners in order to receive data. So again, you're not going to get data from somebody you're not expecting to get data to and who you haven't done the kind of testing over the IZ gateway to and ensuring they're meeting your data quality standards. Similarly, really important to keep in mind the security pieces of all this, right? We know that's really important. Data is encrypted while in transit, and neither APHL, which can host the IZ gateway, nor the IZ gateway itself collect or maintains PII. The IZ gateway conforms with all the policy framework security standards included in the agreement signed by all the exchange partners. Again, those are the kind of pieces we've talked about: the DUA, the MOU, and the PJA. So that is a quick overview of the IZ gateway and the use cases. And now I will hand it over to Chris to discuss the legal framework and get into the details of the PJA. So Chris, go ahead.
Great, thank you, Kory. So go ahead, one more, please. So I'm going to start kind of walking through building off of the background that Kory was just providing for, how all this data is being exchanged, all the various options for how to exchange data. And we're going to talk about the various legal agreements that support or provide the protections for the parties that are opting to share their data. So at the middle of all of this is IZ Gateway in the middle. It's hosted by the Association of Public Health Laboratories. I think of it as one of the Audacious, one of our colleagues on this project described as a post office. So keep that in mind. Next slide. So on the right side of the slide here, those are the various, state or jurisdictional immunization information systems represented. So those are on the right side over there, a variety of IISs. And on the left side are a different category of parties. Those are the so-called provider organizations, which we're thinking of the multi-jurisdictional vaccine provider organizations, like a Veterans Health Administration, like a Department of Defense, as well as, so there's one category of them are, federal agencies. Below that are other vaccine providers that also may be in multi-jurisdictions, like a skilled nursing facility, like a national skilled nursing facility chain, for example, that is non-traditional in a sense that it gives vaccinations, but it is again, a contributor to the whole network of people providing vaccinations. So go ahead, next slide. So those are the main players. Now this overlay is all the various legal agreements, and we're just going to take it bit by bit because there's a lot on here. Let's start at the bottom. The agreement in the green box in the bottom, the APHL, which is Association of Public Health, if you can circle it, Kory, Association of Public Health Laboratories, the data use agreement, that is the agreement that is entered into between, on the right, the individual IIS, each state or territorial IIS, that is, going to be using the data sharing services of the IZ Gateway. It is the parties to the agreement are the IIS and the IZ Gateway itself. So that's one agreement. That's one that dictates the terms of sharing with IZ Gateway. Now over to the right, the MOU, the Memorandum of Understanding to the right side by the IISs, that is the agreement that jurisdictions and states or territories, again, enter into in order to share data with each other or with whatever jurisdictions, a state or a territory decides it wants to share with. There's the standard, the interjurisdictional MOU, and the parties to that agreement are each of the IISs, whichever IIS they're sharing with. Now, the agreement on the top up there, the provider jurisdiction agreement, that's the one we're going to really focus on today. The current state of affairs is that, well, let me explain. So on the left side over there, we've got those multi-jurisdiction vaccine providers, like I had expressed before. And this is the agreement that covers the sharing of data from those entities with the IISs. Yes, the data goes through IZ Gateway, but the legal agreement itself is the line is between the providers on the left and the IIS on the right, because that's the legal agreement. So the prior state before having this provider jurisdiction agreement, or PJA is what we call it shorthand, is that in order for like the VA or any of these federal agencies to share with state or territorial IISs, they'd have to enter into up to 64 individual agreements with the IISs. But what this agreement, and using the system with IZ Gateway, what this agreement allows is for those multi-jurisdiction providers to use just one agreement in order to participate in this data exchange with whatever number of IISs that have chosen to share, that will be choosing to share data with, you know, these federal agencies or these multi-jurisdiction providers. So that's kind of the big picture of the agreements that we're talking about here. Let's go to the next slide, because we're going to do some more like detailed about each one. So again, this is the one that was on the bottom, the data use agreement between the IISs and the Association of Public Health Laboratories. It is required for participation in all of the 3 use cases that Kory was talking about earlier. You know, the use case 1, which is the multi-jurisdiction providers sharing with IISs, case 2, which is the IISs sharing with other IISs, and then case 3 is the consumer one that we're not going to be talking about otherwise today. The purpose of that data use agreement is to facilitate the exchange of information that goes through the IZ Gateway. Again, whether it's coming from the provider, national provider organizations, or whether it's coming from an IIS and going back to another IIS, it's to facilitate all of the exchange of immunization information through the IZ Gateway. The security, it requires compliance with FSMA, HIPAA, FedRAMP. And also Kory had mentioned that an appendix to, or the appendix, I should say, to the data use agreement is the document on which each immunization information system can select the use cases that it wishes to participate in, the 1, 2, or 3 that Kory was referring to. Next slide. So again, going back to this agreement, I think, well, this is just to remind us that we're looking at that top agreement there, the provider jurisdiction agreement. That's the one we're talking about that goes between these national provider organizations, or multi-jurisdiction, I should say, with the IISs on the right. Go ahead, please. Now we're going to do a bit of a deep dive into that agreement, and the full name of it is called, multi-jurisdiction vaccine provider and jurisdiction agreement. But because it's such a mouthful, we've just been calling it the PJA, and hopefully you'll bear with me and not expect me to say it over and over again. It's just the PJA. So this agreement is actually, it's modeled after the interjurisdictional memorandum of understanding that appeared on the right part of the right side of the graphic. And over 50 of the IISs have actually already signed on to the MOU to share data with other IISs. When this PJA was drafted, it was done with the insight of reviewing 15 different jurisdictions IIS related agreements to make sure that we were covering all the issues that we expected states and territories to be thinking about. And we put out a draft of the agreement to the IISs, received, for the review, we received feedback, and that, certainly was used to improve the document and make it even more representative of what people thought was necessary to go into it. Let me make sure to point out that this is, this is intended as a multi-party agreement. And again, as I had talked before, it's to streamline the number of agreements that provider organizations need to sign. So hopefully, and as well for jurisdictions, IISs, the more multi-jurisdiction vaccine providers get on board with IZ Gateway, already the Veterans Health Administration has signed on, the more federal agencies, or I keep saying federal agencies, but that's just one category of the multi-jurisdiction providers. The more of those that sign on, the less administrative burden there is for each IIS, because then you won't need to have multiple agreements with, or an agreement with each of these multi-state jurisdiction providers. So part of the goal is, besides creating this great network to share data effectively, It's also to reduce the administrative burden on each IIS or multi-jurisdiction provider. Next slide, please. So now we're going to go ahead and do, the parties to this PJA are the multi-jurisdiction vaccine providers and the jurisdictions. IZ Gateway is not a party. IZ Gateway is not a legal entity anyway, but IZ Gateway is not a party. The CDC is not a party. It's a straight line between the multi-jurisdiction vaccine providers and the IISs. And the purpose is for the data exchange of immunization information through the IZ Gateway, specifically the two purposes of immunization reporting and immunization query. So let's go ahead, the push and the pull of data. Go ahead. And these are just, highlighting particular terms that we thought we've either gotten questions about and people wanted to know more about, or we know that these are really topics of interest to answer questions that maybe, already in your heads. So this, the PJA does not prevent any other agreements outside of the IZ Gateway. The IIS, each IIS can continue to share its data. Otherwise, there's no limitation on that through the PJA. Applicable law, it's all applicable statutes and regulations of the state or jurisdiction, including federally recognized tribal governments, U.S. territories, in which the party operates. So your state law, your jurisdiction law is what applies, as well as all federal statutes, obviously. And for those federal entities that are parties to this, they are subject to applicable federal laws only. Next slide. The data exchange is, again, as mentioned, it's the push and the pull. So it's the immunization reporting, the VXU messaging, that where the provider is pushing out immunization information to a jurisdiction via IZ Gateway, and then also immunization queries, whether it's a provider that's querying or a provider that's querying one or more jurisdictions, and one or more jurisdictions provide the immunization information back to the querying provider, again, via IZ Gateway. And as with all of the other agreements the other agreements that we've talked about in the full legal framework, each party determines the information that it provides to another party. That is not, and that piece of it is done via the technical process, but the legal document captures that each party has that right to determine what it provides to another party. Next, please. A few more terms. So immunization information means what it says there, information created by a provider, created within or received by an IIS that relates to past, present, or future immunization status. Could be the provision of vaccine to an individual and medical or clinical information related to the immunization. And as has been asked by some jurisdictions, yes, the receiving party, consistent with your own state law or jurisdiction law, may incorporate the data received into your own data system, your IIS or your clinical records. And the receiving party's control, use, and disclosure, again, is consistent with whatever your applicable law is. Do want to mention certainly that the receiving party is responsible for data protection. Well, any party that holds the data is responsible for data protection. Next. The DEX, so this is, again, just highlighting some of the privacy and security obligations or clauses. A party signing is affirming that they will implement confidentiality policies, consistent with your applicable law to protect the privacy of the information, that there will be, the party will implement appropriate administrative, physical, technical safeguards to protect privacy and security. You probably recognize that as HIPAA language. HIPAA is the floor for providers in this. And all reasonable efforts to implement industry standards for information security are expected in the agreement. As far as breach notification, HIPAA already has very robust breach notification requirements. Not all of the data passing through obviously will be necessarily, well, the breach notification that we wanted to include here was adding the additional obligation that the receiving party, if the receiving party, discovers that there has been some kind of, inappropriate data sent to them, then the receiving party has to make a reasonable effort to identify the source of the data that it received through the IZ gateway and notify the sending party and the administrator. So that's just going the extra step to make sure that parties feel comfortable. Next slide. I think, right, this is kind of the boilerplate, typical language you'd see in a contract. Governing laws determined. There's a clause that lays out withdrawal and termination. The details of a party that wants to withdraw or terminate. You'll see at the bottom down there that there's the period of agreement is that there is no fixed term. So the withdrawal and termination terms will guide a party should an IIS decide not to participate any longer. There's no monetary exchange called for in this agreement. There are no warranties other than best effort. And the limitation of liability clause lays it out that the parties are responsible for their own liability. There is no indemnification through the process. Next slide, please. And so also to understand is that when you remember looking back at that graphic, the information is, the legal agreement is between the multi-jurisdiction providers on the left side of that graphic with the IISs on the right side of the graphic. The information actually, it flows through the IZ gateway in both directions. And while it is flowing through the IZ gateway, and the IZ gateway itself is not a legal entity, it is a system that's owned by the Association of Public Health Laboratories. So this agreement needed to have, because it is a multi-party agreement, it needed to have an agreement administrator. So the CDC is the agreement administrator. So the CDC, you can see some of its responsibilities there. It is the entity responsible for issuing any kind of notices that are called for under the agreement, maintaining signed copies from all the signatories. Because again, since this is a multi-party agreement, as an IIS signs on to it, you don't get a copy of everybody else who has signed, every other IIS that has signed on to it. The CDC will keep a copy of all of the signed copies from the signatories, is what I'm trying to say, and will make accessible a list of all those parties to the PJA to those who have signed on to the PJA. They will be maintaining the contact information, for the legally obligated or the contractually required notice provisions, and make updates as needed. And the CDC is also in the role of facilitating, addressing any questions or concerns. Some of you may have seen any legal questions that you have about this. For example, you'll be directed to send them to the folks working with the CDC on this, and then they parse them out. That some of your legal questions may come back to us, for example, at the network, to offer whatever legal support you may need. So they're facilitating that. Next slide. Okay, so this has been a lot of information. This is the legal piece is done at this point, and now it goes back to Kory.
Great, thanks, Chris. And at this point, let's open it up for questions. So we've got the chat panel, we've got the Q&A panel. Feel free to pop your questions in as they come to you.
And please don't hesitate to ask for something to be repeated if you need that for the second follow-up question. Let me also introduce my colleague, Carrie Waggoner, who's a deputy director at the Network for Public Health Law. She's also joining us. She's been one of the attorneys involved early on with the IZ Gateway, so she's also available for answering questions today.
Well, we've got one question asking about the term of the PJA. Carrie or Chris, do one of you want to take the question?
Well, there's no fixed term. There's no fixed term in the agreement, so it is as long as the party wants to be involved in it.
Great, thank you. And I know we always get the question about the slides. The slides and the recording for this webinar and the other webinars will be available on the NPHL website. So if you want to access this information after this, you are welcome to go back and be able to access it on the NPHL website. Other questions? Got a quiet crowd today. Right, great. So our next question is, do you have a list of non-traditional vaccinators that are expected to enter into this agreement and exchange with an IIS? Well, that's an interesting question. I can take the first cut at that. You know, I wouldn't say that there's necessarily kind of a specified list, right? So, you know, obviously VHA is the first that's kind of leveraging the PJA. You could imagine some of the other federal agencies will as well. But I don't think there's a specific list one way or the other that's kind of set on this, right? But if that does not answer the question, please kind of add that into the chat, or Chris or Carrie, if there's anything you want to add on that front, please feel free.
And this is Carrie. Hi, everybody. I'm a colleague of Chris and just joining for the Q&A session. So I think there's not a list of non-traditional vaccinators yet, although I know, as Kory and Chris discussed, we've got sort of the skilled nursing facilities and long-term care facilities that we anticipate. But once those entities start signing on to the PJA, you'll have access to that information through the administrator's responsibilities.
Great, thanks, Carrie. So the next question, can splash this up on the screen here. So yes, if you have follow-up questions, either more generally about the IZ Gateway or specifically about the PJA, please send them to izgateway@cdc.gov, and we will make sure to get back to you.
And, you know, I can actually offer this too, is that the webinar, we're giving it 2 more times next week. And with that feedback, you may want to jump on one of those webinars and catch the first half again. Yes, it's a lot of information, but maybe if you might catch more the second time around, and we can slow down a little bit too, because it looks like we've got time. Yeah.
Other questions for today?
So while we're waiting for any more questions, let me chime in with that on January 14th is when an email went out from the CDC with a copy of the PJA and some other additional information that went along with it to introduce it to folks, to announce these webinars also. And there was also a really handy document that went with it that Carrie had actually prepared, which was a side-by-side, or oh, I can't remember the terminology for it now. Carrie, it was a side-by-side, basically a walk, not a walkthrough. Crosswalk. A crosswalk of key terms in, you know, 2 of the agreements. So that kind of helps synthesize some of the information as, you know, particularly attorneys are sitting down and trying to figure out how all these pieces come together to create this legal web to protect the data and to allow for its sharing. And if you did not receive, or you were not on that list for the January 14th email, I guess you can feel free to put your name in the chat, put your email address in the chat, and it can get forwarded to you directly, because that provider, that not only gave you the copy of the document, but gave others some contextual information too that you might find particularly helpful.
Yeah, and as Chris mentioned, we do, and it's on the screen now, we do have 2 more webinars coming up. So if it's helpful to you to kind of hear all this again, and have another opportunity to answer or ask and have us answer questions, you've got 2 more opportunities. So our next one is on the 16th, and then our last one in this series is on the 18th. The other thing, obviously in some of these calls, we've gotten very detailed questions, very specific to a kind of particular state's laws and kind of policy framework. So we can certainly have sidebar conversations as well as needed if there are kind of very particular circumstances to your state. So, like in the last call, there were a few questions related to consent and how all that plays in. So certainly recognize there are unique circumstances in different jurisdictions, and we can kind of dive into those details as needed. So. Well, let's give folks 1 more minute. Silence doesn't scare me. I'm always happy to sit and wait for people to come up with questions, but we'll give folks like another 30 seconds, a minute. And if there aren't any other questions, I think we'll close out for today. But again, if you think of things after this, please join our next webinars or send them to the email box as well. All right. Well, I don't think we have any other questions for today then. So I think we will wrap up. We appreciate everybody's attendance. Again, if you have additional questions, we've got the future sessions coming up, and you can feel free to shoot them to the email box. Again, we're really excited about the momentum that's building here. We've already got 6 states that have signed, and the VHA has already signed. And again, we kind of want to keep things moving along. So if there are other things we can do to help answer any questions you have as you're reviewing this agreement, please reach out. And with that, I will just thank everyone for their attendance today, and I hope everybody has a good rest of the day. Thank you.